Good afternoon and welcome back. Now we're going to talk a little bit about how we take research and put it into practice, and how best do we do that when we look at an evidence-based practice nursing standard workflow. So, quick question. Tell whether the following statement is true or false. The use of study findings in a practical application unrelated to the original research is evidence-based practice. Think closely when you talk about unrelated to the original research. And that really is the statement that makes this false. So research utilization is the use of study findings in a practical application unrelated to the original research. But evidence-based practice is really basing clinical decisions on the best possible evidence. And one of the things that I hope you walk away from this course with is how exactly do you determine if it's the best possible evidence? And how do you read a research study to make those decisions? So again, research utilization really looks at the practical application in an unrelated to the original research or translational research. But evidence-based practice really is not developing research or looking at research about, okay, they researched it in this group. Now let's change the research question a little bit and research it in this group. But this is really taking what is in the research and combining it with some other things that we see in practice and making that be the basis for our clinical decisions. And the things that we marry that best evidence or best research out there is we marry that with not only, as I mentioned in Chapter 1, patient preferences and values, because that has to be at the center of those decisions that we make for patients, but also our clinical expertise. So having some situational awareness of what works in our clinical practice area. So for example, I work in a safety net hospital where it is the county organization. We are not a resource-rich environment. We do have what we need to take care of our patients, but we don't have a plethora of extra money to just buy equipment because it's the latest, greatest piece of equipment out there. But if given the best evidence, and it is what is best for our patient population, we may use our clinical expertise and what we've learned to advocate for a new piece of equipment or a new way of doing things. So we need to look at evidence-based practice, not in the vacuum of, well, this is what the best evidence says, or this is what research is telling us to do. But how does that look in the environment where we're practicing with those staff and patients that it is going to impact? And I do love that kind of visualization when we look at evidence-based practice, and that it is not just only about research. So some tools or underpinnings for evidence-based practice. In your book, it really talks about the different types of evidence-based practice standards and how the Cochrane collaboration and some of the kind of best practice institutes really look at providing the guidance for evidence-based practice, whether that's medicine or psychology. And when we look at nursing practice, there are two additional institutes or guidelines that we have really adopted in the state of Ohio. And that is one that is based out of the Ohio State University, and that's called the Fold Institute. And they really have been kind of leading the way in implementation science and evidence-based practice in the state of Ohio. So if you're ever interested or you become a nerd like I am and are interested in evidence-based practice, it's a really great place to kind of find best practices related to implementation science. Johns Hopkins is another one that has an institute related to evidence-based practice and really has become some of the gold standards. If you're, like I said, if you become a nerd like me later on in your career and you really feel strongly about evidence-based practice, these are some great resources for you. So this is our next topic, and what may be used to rank study findings according to the strength of evidence provided? So if we look at some of the options here in this question, those are actually different levels of evidence. And if you've ever taken a research course that maybe was non-healthcare related, many of the other professions actually use these things, these other type of findings, like randomized controlled trials and systematic reviews. So actually the answer is an evidence hierarchy, and that really looks at how to rank studies when you're reading them to the strength of evidence provided. So systematic reviews are a compilation and evaluation of multiple research studies kind of coming together and then picked apart at a level where it's going to build kind of not necessarily a summary, but it's going to build an evaluation of multiple studies, and what are those studies telling us. Randomized controlled trials are what we think of when we think of what is often called bench research. You're in this group, you might be in a control group. These are the types of studies. We don't see a lot of those done in nursing. We do see a fair number of those done in medicine, and I will tell you, I actually signed up to be in a randomized control trial. It's not a true experimental design, but I have the potential to be in a placebo group. And so I find research not only from the reader's perspective, but also as the participant. And then electronic databases are used for accessing research. So resources for evidence-based practice are those systematic reviews that we talked about, clinical practice guidelines, and you will see those a lot of times, especially when you get into practice, and when you look in your textbooks, they'll often be a summary of the evidence that have created clinical practice guidelines based on what's the best evidence out there. Care bundles are another example of kind of best practice bundles, and when I think of care practice bundles, I think of pressure injury prevention and falls prevention and infection prevention, and those things that are where we know that if we do a group of interventions, we have a better outcome than if we pick or choose one or two. Pre-appraised evidence is another example, and then PICO questions are something we're going to talk about in depth down the line. And a PICO question can be used for evidence-based practice, but a lot of times it's also can be used to kind of frame a research study. At least it gets you kind of in a thinking mind frame that will help build your research study. So there's some definite barriers to using nursing research in practice, in nursing practice. Some characteristics of a nurse that have a huge impact on nursing, the use of nursing research in practice is just time, right? If all of us had an unmeasurable amount of time, I don't know that nursing research would be what I'd be reading, but we know that nurses are rushed from the beginning of their day to the end of their day, so they're definitely not reading nursing research probably likely in their daily activities. We also know that a lot of people don't want to read nursing studies when they come home at night. The other issue is that there may be organizational factors. So like I'm pretty fortunate that I work at a teaching hospital and that I work at where I have access to a library with full text articles. I have lots of reimbursement that I can use for professional development activities. So I have access to nursing research. Now, is all nursing research the same on the same level? Absolutely not. And that's really where there are barriers to using nursing research in practice. And that comes from the fact that not all research studies are created equal. And one of the things, again, that I hope for you to walk away from this course is how do you identify those good quality studies that really can impact your patient care in a positive way. So question number 3, tell us whether the following statement is true or false. So systematic reviews can involve quantitative meta-analysis methods that integrate findings statistically. And this is absolutely true. So this is really where we are going to take a look at studies, integrate them, evaluate those studies, pick the best pieces of those studies, and share those findings as if it was one study in and of itself. So you are going to literally get the best of both worlds. The best part about systematic reviews is if you can find a really great systematic review related to your topic, not only are you going to get the integration of those studies, but you also have individual studies that you can evaluate for putting that information into practice. So if you can find a systematic review on a topic, you are in a great place. So there are some forms of integrative studies or reviews. Those are narrative or qualitative integration, really looking at a traditional review of those quantitative or qualitative results, looking at each one of those studies and kind of determining what is the best of those studies. A meta-analysis, really, which is looking at a statistical integration of the results, and then the meta-synthesis, really, which looks at a theoretical integration of those qualitative findings. So what are the things that maybe not as quantitative, but those were qualitative? When we talk about quantitative and qualitative is the qualities or experiential or the experience of someone, versus quantitative, which are those yes and no and Likert scales. So we talked a little bit about care bundles, and I gave you some examples, but care bundles are really looking at what is a set of interventions that, when combined, treat maybe a cluster of symptoms or prevent in a group of illnesses based on the implementation. And I'll give you a perfect example. So at our institution, we recently did a lit review and looking at what are those best practice solutions to prevent pressure injuries. We had a pressure injury, not a problem, but we definitely had some area for improvement. And so as evidence-based practice specialists and clinical nurse specialists and clinical quality and evidence-based practice specialists, we went to the literature and really looked at if there was a bundle already in existence, because we don't want to reinvent the wheel, and also what are those things that, when done individually, can really impact a pressure injury rate and pressure injury prevention. And some of the things that we really looked at was how often to turn our patients. Is there really best evidence related to that? And there's some evidence out there that says really the Q2 hour turning that came that we often subscribe to actually reaches far back as Florence Nightingale, and that there isn't a whole lot of evidence, it's just tradition, but that regularly turning your patients and making it a meaningful turn versus doing it on a regular schedule is actually more meaningful. And there are some kind of electronic guides that we can use to judge if a turn has been good. And we actually participated in a research study here at Metro looking at a product called the View. And the View really looked at, what a good turn looked like and what does offloading look like. What are those things that we can use with turning? Is a pillow the best option for us? And what we found is that wedge cushions are actually a much better option than a pillow to turn patients and keep them offloaded. So we looked at those care bundles that were something that we could put into place to prevent pressure injuries in the long term in our patients. So I love this chart, and when you look at, when you start to do some evaluation of articles, I want you to pull this chart back out because this really is the gold standard. And this comes right from your textbook. I didn't develop this myself. I'm not this smart. But this really talks about the different levels of evaluation. So as you can see at the top, we talked about a systematic review or a meta-analysis, and randomized controlled trials, of course, are always the gold standard in any type of study. We don't see a lot of randomized controlled trials in healthcare because if we know something is good for a patient, we tend not to want to randomize someone out of it. But that is those are the best level. We know that non-experimental or observational studies fall somewhere in the middle, and those are what we typically will see with nursing studies. There's some controversy about the use of qualitative studies and the fact that qualitative studies and qualitative are again those lived experience or more of looking at themes, less science-y. I think when you look at them, they're not have control groups. It's more about looking at themes and processes. Those fall further down on the evaluation scale, and I will tell you that there's some argument that if a qualitative study is done well, that there is a lot of information that can be gleaned from them, and a systematic or meta synthesis of qualitative studies actually should fall higher in this hierarchy, but this is the currently accepted hierarchy. And that obviously on the bottom is those expert opinions or internal evidence. And as you can imagine, if something is only happening in your institution or it's only evidence that you've gotten internally, it's not going to be as valid or as heavily weighted as something that's been done as an experimental study. So when you look at evidence-based practice models, there are many out there, and I will tell you the Iowa model is the model of evidence-based practice that we use here at Metro Health, but it doesn't mean that it's the best model out there. It's really what model do you use in your institution to look at the research and put it into practice. And the Iowa model, it just is the one that I think is most widely accepted and probably the reason why we went with it. And just to give you any model that you use for evidence-based practice should kind of go down the same path. And really the Iowa model really helps us with a series of activities that help us frame our decision-making process. And really when we look at doing quality improvement or implementing evidence-based practice, the Iowa model kind of guides us through that process. And the first thing it's going to ask is, is this a problem that is a priority for your organization? So do you find that this is going to make a difference at the clinical level, at the clinical bedside? Is it going to make a difference for our patients? So if we haven't had an infection in the last 4 years, why are we looking at infections and infection prevention? Is there a sufficient research base? So Is it something that's already been done in the research? Because if it hasn't been done in the research, then we need to go down a different road. So if we're looking at a problem and we look into the literature and there's nothing written about it, then we need to create that research versus doing evidence-based practice. And then, is this change, when we look at what the evidence says, appropriate for our specific area? So, we're not going to take something necessarily from peds and automatically choose to implement it for an adult population. Or we're not going to take something that's being done in an outpatient area and adapt it into practice in an inpatient area. So if we're going to say, that's a really great thing that they're doing in peds, but it's never been done in adults, that's a perfect research study. So if we feel like this has the impetus or the potential for positively impacting our adult patients, then that's a great research study. And there have been a lot learned both ways, both adults to peds and peds to adults. So individual nurses can put research into practice. What is our first step? So the first step to any problem is finding out what the clinical question is. So we need to find an answerable clinical question. So those best clinical questions come from the nurses who are at the bedside. And it's those things that make the nurse stop and say, I wonder if we did it this way. I wonder if there is a better way of doing it. I wonder if there's research out there that has said that there is something that we can do at our level to accept and move forward to positively impact our patients. The next step is searching for that evidence. Appraising it and synthesizing it is probably the key step of the process in adopting evidence-based practice. Integrating that evidence with other factors, and then the evaluation. And if you look at this process, it might look a little familiar to you if you're familiar with the nursing process. This is exactly what we do when we approach a problem with a patient. So an infection problem, we're going to diagnose them or ask that clinical question. We're going to take all that's in those interventions and the best of those interventions. We're going to put them into play and we're going to implement them. And then we're going to assess for effectiveness. So really this is framed on everything that we do in nursing. So major steps in an evidence-based practice project is asking that well-worded clinical question, acquiring the research evidence or what's in the literature, appraising that evidence. And again, if you don't find good research, people will always say junk in, junk out, right? So if we pick that evidence that may be not so great and we try to apply it, we're probably not going to get the practice change or the outcome that we're looking for in the end. And again, this is just another framework of the individual evidence-based practice project. So when we do look at the evidence and appraisal of the evidence, we're looking for some different things. So is it valid? So when you read it, does it look like a good research study? Did they study enough individuals? Was it done in an area that is your area of expertise? Were the findings what they hoped they would be? Were they statistically significant? Then we're also looking at the clinical importance of the findings or the magnitude, which is, okay, fine, they found this, they found its statistically significance. Now, does it apply to my clinical situation? Does it have clinical importance? So, patients never lying in bed might be the best thing for their skin, but that's not necessarily something that we can do on an inpatient area. So you always need to find out, is there clinical importance? Does it apply? Does it have generalizability? Is it associated with costs and risks? So every patient on a skin prevention mattress, a skin issue prevention, super expensive mattress, there's a cost with that. Yes, there might be a benefit, but is the cost enough to put the money or the investment in to make that purchase? The other thing is skin pressure injury prevention mattresses actually have their own risks, especially for the patients who need to be on spinal percussion. So it may not be applicable to every patient that we take care of. So when we look at evidence-based practice in context of an organization, we really look at evidence-based practice and those interpersonal factors into account. So where are we? And I will tell you, I did attend the Fold Immersion class. And one of the first things we did was, how ripe is our organization for the implementation of evidence-based practice? So not every organization is at the same place when it comes to the implementation science of evidence-based practice. So you need to be aware of those factors. And one of the questions that you will be told to ask over and over again is this a magnet facility? Is this a magnet facility? Because one of the things that a magnet facility gives you is that it's usually an environment that is all about evidence-based practice and the implementation of quality improvement and that constant quality improvement process that's going on. Triggers for evidence-based practice is, we may look at them from two perspectives. So is the staff bringing forward problems in need of a solution? So you may be a nurse that says, I just wonder why we change IVs out for every single patient every 3 days. So for a long time, that's what we did, right? We changed out all IVs in all adult patients every 3 days. This ended up being a research study, but was that really what was the right thing to do? And if you looked into the research that was eventually done, was that there's a lot of evidence that's available out there that that's actually not a best practice anymore. So now in adult patients, based on a research study and actually it was many research studies that were done by those working in IV teams, that was not the best practice. And actually, we borrowed something from pediatrics. Pediatrics only change their IVs when they're no longer good. And that's actually, according to the INS or the Infusion Nurses Society, that is the best practice we should have all adopted. And so we adopted that practice a few years ago. So the what ifs from the clinical staff is going to bring us our best evidence-based practice, as well as our best research studies. And then we are always going to have some triggers to implementation of evidence-based practice that comes from reading our literature. And I will tell you, one of the best investments you can make in that first year of practice is just find wherever area that you're working in and find their easiest readable journals that bring you current evidence-based practice guidelines. So, for example, my background is med-surg, and so there are research journals regarding med-surg practice. But I will tell you, my first few years of practice, there is no way I was reading research journals. I really just wanted to know what has been done in the research that has been implemented in evidence-based practice and quality improvement, and with an interspersed research study here or there. And actually, the Academy of Med-Surg Nurses has a really great journal that has all of that. It has some research articles in it, it has some quality improvement articles in it, and then it also has some kind of continuing ed type professional development content in it. That is going to be your best bet those first few years of practice. Same with critical care. Critical care has its own journal. I'm sure that those things exist for mother and baby too. So the next step is developing the pilot test. So the next thing we want to do is, after we've asked the clinical question, we've gone into the literature, is really looking at where can we pilot that intervention, whether that's implementation of an evidence-based practice guideline, but really this is where we're going to do this on a small scale, usually maybe 1 or 2 units, usually with a small set of patients. And how easy was it to implement, and did it show us the outcomes that we wanted? And that's really when we evaluate that project to know if we should spread it out and if it's generalizable to those other areas. And I'll give you a perfect example of this. We recently were trying to improve our Press-Ganey scores, or our patient satisfaction scores. And so we took 2 units who had been struggling with our Press-Ganey scores related to nurse communication skills. And we know that bedside handoff has been a best practice for quite a while, but we were having some resistance with our staff in implementation or acceptance of purposeful hourly, not purposeful hourly rounding, but purposeful rounding, as well as bedside handoff, because we know those have been in the literature for years, but we were struggling. And so we picked 2 units to pilot on, and we did some simulation. So we looked at, was simulation a way to share that with staff? We went into the literature, and there was a lot of evidence out there to say not only are those 2 things a best practice, but that simulation is a great way to teach it. And we did some simulation. Once we did simulation with that staff, and we did see some positive outcomes related to Press-Ganey scores, we realized that this was generalizable to some of our other units. And we actually most recently generalized it and shared it with the emergency department. So we did have to evaluate its usefulness as well as its applicability, and we had to make some minor changes. But we know that that bedside handoff is super important regardless of where you're working. And so we've already started to see some positive factors and positive outcomes coming from that simulation. So that's where starting small sometimes can be the best way to do it. Now, if it's something that, like changing IVs where it needs to happen house-wide, a pilot project's not going to be as easy to accomplish. So again, your role as a new nurse in using research evidence is subscribe to at least 1 journal. Try to attend professional conferences. And you need to, when you do go to those professional conferences, you need to think critically and think back to this course and look at the evidence and the outcomes and what is being presented during those presentations to make sure that it meets the standards and rigor of what the changes you want to be making in your area. Become involved in a journal club, and we're actually going to be reinvigorating our journal club here at Metro Health. That is something that you should ask when you go into interviews, if that's something that an institution have. And then once you get your feet wet, pursue and participate in those research projects or evidence-based projects, because that is really where you're going to find your passion and really develop your skills. This is a very short course. It only lasts 8 weeks. Now, granted, this will be built upon as you finish your degree, but it's going to become most meaningful when you put it into practice after you graduate. All right, well, hope that was a quick overview of evidence-based practice, and we'll see you in the next module.